folks. Thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next hour or so discussing a topic that's of great interest on an ongoing basis, but particularly pertinent to today's situation with the pandemic and some of the ramifications that it's had on folks with their employment situation, folks trying to deal with the cost of perhaps a marketplace plan, and how that affects our target audience for the most part, which is the Medicare population, and how they deal with it. So we've combined different pieces of information from CMS to help with this, including a presentation that they have available for us that is a great source for you to use in either a webinar or a seminar situation, however you're presenting to groups as well. But it's a great piece for us as a bit of review on Medicare in some circumstances, but also a way that we can speak knowledgeably to the prospects and clients that we have that are in this particular situation. As a bit of housekeeping, we are recording today's presentation, and much of the information that we reference through the course of the presentation, well, it's going to be sent by email to everyone who has RSVP'd to today's webinar and made available to others thereafter. You'll note in the software package that there's a section for both questions and chat. We ask that you put your questions, logically, in the question box, and realize that we will make certain that we address them. But one of the things that I will ask of you today is, if you would, in that section, place in there the biggest challenge that you have had in dealing with folks that are in this situation. If you haven't been active or been exposed to this, obviously you don't have to do that, but we want to make certain that we cover the things that come to mind, the challenges that you have in dealing with this population, and making certain that if we're not able to address them immediately in today's presentation, we're able to get you that information as part of a research follow-up as well. And I thank you for doing that. One of the other things that we'll do to start is basically give you a little bit of level set as to who Premier Marketing is. For some of you, you're very familiar with us, some not so much. So we're a national marketing organization that was founded in 1968. We're part of the Integrity Marketing Platform with offices across the country. We offer insurance services through independent insurance agents and agencies such as yourself, and we do so through a contracting arrangement that's at the highest possible commission levels, with recruiting contracts available for those who qualify. We do so through a full portfolio of products that include the base programs that you'll need to address today's topic, the Medicare Advantage and Medicare Supplement programs, the Part D prescription plans, the standalone PDP programs. But we also offer a full portfolio of life insurance and annuity products, final expense life insurance, pre-need plans, long and short-term care programs, disability income, and ancillary programs such as dental, vision, hearing, critical illness, cancer, hospital indemnity, and accident plans, and a recently rolled out telehealth program called MD Live. These are particularly pertinent for this situation because when someone makes a major change when it comes to their health insurance, they are very open and receptive to other needs that they may have and solutions that you would propose for those particular scenarios. So we want to make certain that we're addressing it through a comprehensive portfolio of programs. You got the national carriers available to you through the Medicare Advantage contracts available, and strong regional carriers in many markets as well. And that same philosophy carries over into the prescription drug programs, where those national carriers are available to you through our organization, in many cases part of a contract that enables you to offer the Medicare Advantage programs as well. When you look at the Medicare Supplement programs, it's a robust portfolio and very pertinent to today's situation as well, because some folks may prefer this because it's a guarantee issue type of situation, but we also have tools that can help you be very successful in this space regardless. When we speak to the ancillary products, in each of the categories that we've discussed, you got the leaders in that field available to you through our organization. And these are programs that are very pertinent because folks, if they've come off group insurance, lost the coverage, picked up marketplace plans, they've also, in many cases, lost some of these coverages, and because of economic circumstances, may or may not have picked up a replacement for a long past, short-term pass of group coverages that they have. So when you look at the overall situation we have in the Medicare space, you don't come on a webinar like today without hearing about the silver tsunami, the aging of the baby boomers, the one every 10 seconds, 10,000 plus a day. But if you're looking at the market based just on age, we're not seeing a true representation of what we have available because, as we've discussed now, the working aged, as they're called certain times, a bit of an offensive term in my mind, but some of them may not have accessed Medicare benefits immediately when they were first eligible. So we need to know about, perhaps, do you have your Part B, other situations, and helping them through some of the basic steps that can help them be fully eligible for many of the programs that we offer. And we are seeing people, because of one reason or another, working past the age of 65, and we want to make certain that we're able to address those folks as they become viable prospects for us. And we also have to take into account this category, the 1/6 to 1/7 of the Medicare population that's actually under the age of 65 and accessing those benefits because of disability. You'll find in today's new normal, we have a number of people that may be disabled, maybe went back to work, still have Medicare coverage, and now no longer have employment. So we have to look at solutions for each of them because they have some challenges in Medicare. We're all aware of it. 2/3 of the population, well, they've got 3+ chronic conditions they're dealing with. And many of the folks in this target demographic, well, they're income impaired. We'll put it that way in a manner of speaking. And sometimes the savings becomes an issue as well. We want to make certain that we're able to address all of the situations that are available, or as many as possible, and be able to deliver a solution to them no matter how they come to you. But we're seeing an increased number over the last year or so of folks that are dealing with marketplace plans and loss of group coverage. So we want to make certain that in each of the choices they have available, they're aware of the possibilities for that additional coverage. Because keep in mind, they don't have to do anything. They can self-insure if they choose to. They can even decline the optional Part B in Medicare. Most don't, thankfully. There are a limited number that will stick with original Medicare for the medical portion of it, pick up the Part D plans just for the medication. Or they'll augment that coverage to cover some of the shortfall on the medical cost through a standardized, modernized Medicare supplement. Or some folks will opt into the Medicare Advantage plans, the Part C programs that integrate, in many cases, both of those coverages together. In each of these circumstances, these are choices faced by folks that are on a marketplace plan that may no longer be able to afford it or have other options that are available to them. So we want to make certain, regardless of their choice, we're able to help them. And we're seeing as people come on Medicare, it's a kind of an even split between Medicare Advantage and Med Sups as to the choices they have. This is a piece of information delivered by Deft Research. And we see a category that says original Medicare only. Keep in mind, in certain circumstances, that might be a bit of a misnomer. Because some of the folks coming off group coverage or realizing that they have Medicare as part of a component, they may have declined the Part B and are still on a marketplace plan. Those folks may have other options available, retirement options through the company they work for. During this circumstance, not very likely, but they may be accessing benefits through the VA. They may be a dual beneficiary that have both Medicare and Medicaid. They may be folks that are accessing just traditional Medicare, just as it says. So we've got different categories that folks fall into, and we want to make certain we can address them. And part of that is making certain that we can translate the industry jargon that comes as part of any industry. I have a brother-in-law who's a computer guy. Boy, he speaks a different language than I do. But if he were to look at some of the terminology we use in the Medicare world, even though he's a very intelligent fella, he may not be able to translate the acronyms. So part of the follow-up we send to you will have a link to this tool that gives you translation to those acronyms so we can make certain that we're able to explain the programs properly. And because Medicare is a regulated portion of our world, you have the standard election periods, which in this circumstance, hey, they're all passed. It doesn't apply to some of these folks, but the special election periods do. And there's a variety of them that folks will access for one scenario or another. We have found that many of the folks will qualify for a special election period. The majority of people on Medicare actually do. It's a question of, is that the best move for them? What is the proper circumstance for them to follow based on their current situation? Well, we have the standard ones that we see year over year, and then we have the extra ones that come as a special election period because of Mother Nature or other circumstances. One of the attachments that will come to you is a current listing of the weather SEPs that are still ongoing. And so you'll have that information. And that's all important because people on Medicare that are looking for an annual review, or people that come off of coverages such as what we discussed today with Marketplace, well, they're not reviewing their coverage annually. We've got some folks that on Marketplace are prompted to, but we'll find that our outreach is one of the most effective tools to reach the population that basically ride the familiar pony, walk the same cattle path in the pasture, and don't realize that the programs change and we can save them substantial money or offer them other alternatives that may be better for them in their circumstance. And that's important, particularly for some of the vulnerable population that we meet. And those are the folks in many circumstances who may be on a Marketplace plan, moving into a different situation. We want to make certain we help them understand the programs that they have and that they're accessing information in a comprehensible manner. Folks aren't using the Medicare site, the Medicare.gov plan finder for the most part. So we have options to help them explain to them the coverages that are available in that circumstance, but we also have tools available that we offer to our agents that can help you as well. And it's important because we see the folks that have lost coverage within the last year, you got a chunk of them, 14%, that are accessing care through Medicaid or Medicare. And that falls more into our sweet zone, so to speak, as to a viable prospect. Still have to do, obviously, our due diligence to see what their individual situation is, because we don't sell Medicaid plans, plain and simple. Is that part, however, of an eligibility for different types of coverages they have available to them. And it's important because we not only want to help these people coming out of the blocks, we want them as part of our book of business on an ongoing basis, hence the use of the entire portfolio of products to make certain that we're addressing all of their needs and all of the issues that they face on an ongoing basis. And we need to be prepared to do it in a couple of different circumstances. The new normal has conditioned many of us as agents to go to a completely virtual environment. We're doing things through Zoom, different electronic pieces, through our Medicare Center, some of the things that we're doing on a virtual basis, but portions of the population, they're going to still want to meet face-to-face over the kitchen table. Different states have different regulations right now as to how you can do that, or if you can. Well, the insurance business is deemed an essential industry, so you can meet with them face-to-face. Depends on some of the local regulations as to how you do that. And we want to make certain we abide by those, certainly. The folks we're talking to, however, they're becoming trained as to receiving that information virtually. And for folks that have come out of employment recently or are dealing with some of the Marketplace plans, they are becoming increasingly aware of how to shop online and how to receive the information. And if you think about it, in your own circumstance, how many of you have had virtual appointments with your doctors? I've got a particular physician over the last year. I've seen him 9 times. I've seen him on the screen. I've seen him on my smartphone. Never met the man face to face. So we are having providers of the care that we're insuring them for, accessing it virtually. And hey, in different parts of their normal life, they're being trained as well. You're seeing that same thing come as preamble to dentist appointments or hospitalizations or other ways of delivering care, but other facets of our life too. Many of the religious services over the last year have been done virtually. So we have a population that is becoming increasingly aware of delivery of information from folks as us, research on the internet, all that lovely stuff. So they're becoming much more accustomed to receiving the information virtually as well. So as we take that background and look at the possibilities that we have now for plan choices for folks, title's a bit of a misnomer because you can be on Medicare without being 65, obviously, but that's a common situation we will find with people that are on a marketplace plan that are coming into Medicare by aging in, or may have deferred Medicare coverage and continued on marketplace plans because of subsidy credits or whatever other reason there may happen to be. So we have in our arsenal presentations made available from CMS. So we're borrowing heavily on this information for you in today's presentation. This actual presentation that I'm showing on the screen now will be part of the follow-up. And so as we go through these slides and run through them as a presentation to gather the information we need, you will have this information to use as well in your presentations if you're working actively in seminar selling into the community or hosting webinars on this topic. Very pertinent for today's rotation of the programs that we can offer to centers of influence in the community, be it live or virtually. So it's a great way to enter into the public speaking world, so to speak. It gives us then the opportunity for a very pertinent program to put in our rotation. Many folks on active in the market for Medicare are working LIS-MSP presentations, acronym, low income subsidy, Medicare savings programs, and other topics about options for coverage. This is another one to put into your arsenal. So watch for that as part of the follow-up. And as we look at that presentation, it is an approved piece delivered to us through the national training program that is part of the CMS offerings that we have. So as we look at that, this is an example of my account on there. It has a ton of different information that is available to you as resources. And this is the organization that has created this presentation that we're about to go through. So it gives us an idea of what we're to discuss. It gives us then the objectives of the programs and an idea of how we handle things in different situations. And, excuse me, it gives us different lessons and different questions that are part of the presentation to make certain that the folks are grasping the information that we deliver. I just got off a different presentation where I attended a GoToWebinar piece that speaks to engaging people in these presentations. So some of those tips will come to you as well as part of the follow-up. But it's important that we engage the population and make them aware of what they need to consider when deciding to enroll in Medicare Part A, the hospitalization coverage, because many people don't understand what all their financial obligations are as they enter into Medicare. And many people think it's free. Some people don't realize there may be premiums on multiple aspects of those coverage, and that most people don't pay a premium for their Part A coverage, the hospitalization. And they have to realize, too, that if they come off a marketplace plan into Medicare, they can no longer contribute to a health savings account, an HSA, if they have Medicare. So we have seen different folks that are in different situations, perhaps higher income people, that will defer Medicare coverages, basically opt out of both. Not always an easy task, but those folks are a different special circumstance. Occasionally you'll run into them. And it's important to note, too, that these folks, their decision can be influenced by the marketplace premium tax credits and cost sharing reductions that are part of the programs to help lower the marketplace plan deductible, co-payments, and co-insurance. Because if you're active in that space, you understand the difference between the different metallic plans, shall we say, bronze, silver, and gold, and how that is influencing choices for coverages currently, in the past, and how that would be moving forward. If folks have challenges with some of the premiums with Medicare, they're dwarfed by some of their financial obligations they may have now if they don't qualify for these credits. If they do qualify for these credits, we need to be aware of some of the other things we'll talk about here shortly. It's also important to note that some of those folks, if they're not eligible for premium-free Part A and they don't buy it when they're first eligible, the monthly premium, that's that penalty that they may be subject to. That is a monthly premium can go up 10% per month. So you don't run across those folks nearly as often as some of the others, but that is a consideration we need to be aware of because we may run into a few. It's also important to note that these people need to be made aware of the fact that there's a monthly premium for Part B. Might seem very basic for a whole bunch of us, but it's kind of like buying that car that we think is so unique. And then we're in that car and we're driving down the road and it's like, oop, there went another one. Oop, there went another one. We become accustomed to the things we know and not necessarily what is general knowledge of the audience that we're addressing. So we need to make certain that they understand that if they get Social Security or retirement from the railroad, it's deducted automatically from that benefit payment, depending upon time frame. And if they don't get that, there are ways that they can pay that premium bill. And if you look at the aging of our population, I'm 61. I act 12, closer to my IQ sometimes it seems like. But for me to get full Social Security benefits, it's not 65 for me anymore, it's 67. So that might influence people. And as there are different philosophies as to when someone actually activates Social Security, starts drawing from it for the retirement benefits. So some of the folks, we may see more of this where they are responsible for paying that premium. They can do it online with a credit or debit card. They can pay directly into a bank account and have it drawn, a draft, of course. They can sign up for Medicare Easy Pay through the website there. And you obviously you can still mail a payment to Medicare, not my strong recommendation. But anyway, that par premium is dependent upon the income from 2 years ago. So it's a rolling type of situation. So you'll run into some folks that may have downsized and they realize gains from their the sale of their house, their larger house going into a small one, and that can affect their premium for a period of time. We need to be aware of it. We also need to make certain that they're aware of it. If they didn't enroll in Part B when they were first eligible, they may have to pay a lifetime penalty as well. And if they are accessing benefits through the VA, that doesn't interact with Medicare. That's a completely different webinar, completely different topic. We have addressed it, so that's in the link to our video library that will be available to you as well. One of the questions is, of course, when must an individual enroll in Medicare Part B? We want to make certain that they realize that if they want a standardized, modernized Medicare supplement plan, they have to have Part A and B. If they want to join an AMA plan, they have to have A and B. If they're eligible for TRICARE for Life or the Civilian Health and Medical Program from the Department of the VA, CHAMP VA, they can have Part B as well. And some of the folks in that category don't always realize that. In order to qualify for that, they've got to have both coverages. And then, of course, it depends upon, in certain circumstances, the size of the group that they work for. So if the employer coverage requires you to have it, you'll see that in many circumstances in groups of 20 and less employees where Medicare is primary. We need to make certain that they realize that that's the circumstance they have, or basically, in that scenario, we're reiterating a message they're getting from their employer too, because they tell them, obviously, and do it before they access Medicare benefits. One of the other things we want to make certain that they know that sometimes there's an automatic enrollment into Medicare, and this is if somebody's already getting Social Security or drawing from the railroad in those benefits, at least 4 months before they turn 65, they're going to be automatically enrolled in Medicare effective upon that date of eligibility. They'll get an IEP package in the mail along with a Medicare card about 3 months before, and the coverage begins the first of the month that they turn 65. My birthday's January 25th. You want to send me a gift, whatever. Just kidding. In this time period, should the same eligibility rules be in play in 4 years, well, I'm going to have Medicare coverage on January 1st. It's the first of the month of which you turn 65. There are, of course, those folks, too, that qualify for Medicare based on the disability. We discussed that. At 15% of the Medicare population, they're entitled to Social Security disability income or disability insurance, SSDI, for 24 months in most circumstances. In order to get to Part B on the 25th month, they're automatically enrolled in it. And there are exceptions for Lou Gehrig's, ALS, ESRD comes into that category as well. So some different things that can prompt an immediate eligibility into Medicare. It's also important to note that if folks delay their Social Security, as I will, and many of us on the call will, there are many of you that are probably younger than I, and to get full benefits under Social Security, you may wait longer as well. And it's important to note that if you don't have that, we need to make certain that folks are aware they got to sign up for different coverages and when it begins, that 3-month eligibility period before the 65th birthday, 3 months after the month of our birthday as well. They're enrolling through Social Security, through their website or the railroad board, and coverage is beginning is based on the month that's enrolled. So we need to make certain we do that. It's also important to note that if those folks have ESRD, they may be eligible for premium-free Part A, but not required to sign up for Medicare. So there are different circumstances, as I mentioned before, with health circumstances. Don't run across them all that often. In the 25-plus years that I've been specializing in this portion of the market, I've ran across them maybe half a dozen times, but it's a possibility. One of the other things we need to make certain that they're aware of is the government's doing different things to make them aware of their eligibility, what their steps are, how to enroll, and the impact that marketplace coverage has if they're enrolled in Medicare. And the government's doing that for us all, so a bit of prep work for us. And that penalty period. What if they miss that IEP? Well, if that window is closed, there are only certain time periods when they can pick up portions of the Medicare coverage. And that's through the Medicare's general enrollment period. This isn't talking about the annual election periods or the SEPs that we discussed earlier in the presentation. This is to get that base coverage with Medicare. And it's that 3-month period, the first quarter of the year, just ended 21 days ago, where then that coverage would kick in July 1st. If more than 12 months had passed when they're first eligible, they could have that lifetime late enrollment penalty unless they had creditable coverage. We need to make certain they're aware of that. And some folks may be eligible for a special election period for Medicare if they delayed, obviously, because they're still working and had group coverage based on it. Those folks don't have a penalty. So voluntary or involuntary loss of group coverage can come into play here for Medicare itself and as a special election period to get them the additional coverages that they'll need as well. I think I like that slide so much I put it in there twice. The canceling of the Medicare coverage, or pardon me, the marketplace coverage that they have because of Medicare eligibility, there are different things that come into play, and we need to make certain that they're aware of the fact that it's an individual decision for Medicare. So self-only comes into play, but we also have to take into account how are they covering the rest of their family. Are there still children in the household or a spouse who may be significantly younger or younger, however it is, and how do we make certain that we're covering the whole gambit of possibilities that are available for that household. So if they look to cancel for just themselves, they can obviously request that the coverage ends immediately or request a date in the future. Because of the eligibility aspect that we have with additional coverages and the fact that start dates are mandated by some of those coverages, hey, if they're enrolling in an MA plan, it's the first of the next month in most circumstances, you can't start it mid-month. So we want to make certain that we time that coverage. And as it mentions here, there may be, possibilities where it doesn't end immediately, and we have to address that. It's also here where we get the tips as to how they do that, logging into their account on healthcare.gov if they're the only one covered, or calling the marketplace plan to do those cancellations. These are the actual numbers that are there. Don't scribble to put them down. You're going to get the PowerPoint, the slide deck here as part of it, so you'll have this to reference in the future. If you're looking at a situation where it's a family plan, that same sort of a resource through the marketplace is available for cancellation. We want to make certain, however, that the coverage is in play for the rest of the family before that's done. That self-insuring for a couple weeks, a month, or whatever it is, that's a roll of the dice. Best left to Vegas or Reno or wherever we go to do that sort of activity if we do. Gambling here, not a good idea. And we want to make certain that they're aware of the fact, in most cases, the removed member's coverage will end right away. So we need to make certain we're timing this correctly to give them the coverage that they need. If an individual has Medicare and they want to keep their marketplace plan, this is something I referenced a little bit earlier, is the fact that if they've got the plan, they can keep it until the Medicare coverage starts, or they can keep it, but once the Medicare Part A kicks in, they may no longer qualify for the advanced payment of the premium tax credit or other cost savings that they have through the marketplace plan. They'll have to pay full price then for that marketplace plan, and Medicare doesn't coordinate benefits with marketplace plans. So it may be advantageous to them to really look at a completely different package, because it could save them significant dollars once they hit that Medicare eligibility. If those folks aren't eligible for premium-free Part A, they can stay in the individual health coverage in the marketplace to get the coverage, and that coverage may cost them less in that circumstance. You don't, as mentioned earlier, you don't run across a whole bunch of people that have to contribute to the cost of their Part A coverage. Remember, Part B, the medical portion, that premium's there. How it's covered one way or another depends upon their individual circumstance. But in this scenario, which doesn't happen all that much, it may behoove them to stay on the marketplace plan if they have that coverage in place and they're not eligible for premium-free Part A. How do you get that? Working the 10 years of quarters in order to fund that. One of the items of interest we need to do is, why would they stay in the marketplace plan instead of having Medicare? Well, if they're eligible for Medicare and they haven't enrolled in it because they have to pay that premium for Part A, or they got a medical condition that qualifies them for Medicare like ESRD, but yet they haven't completed the eligibility factors and applied for that coverage, or they may be in a circumstance where they're in that 24-month disability waiting program. Keep in mind, you got 15% of the population that are disabled, so you'll run across these occasionally. It's also important to note that if they're enrolled in Medicare and they have to pay a premium for Part A, they can drop that Part A and B coverage, keep that marketplace plan, may behoove them to do so, or if they have only Part B and would have to pay a premium for Part A, they can drop that Part B and stay with marketplace. A lot of that is predicated on cost, obviously, and then the coverages that are available through the different plans that are available to them. Marketplace plans in many circumstances have that big deductible co-insurance, so we need to really make certain we're doing an analysis as to not only the coverage, but the financial ramifications of their choice. So one of the things that we have here is a bit of a knowledge question for us. When must you enroll in Medicare Part B? Well, is it A, where you're looking to buy a Med Sup? Is it B, where you're looking to get into the Medicare Advantage plan? Or is it C, because the employer coverage requires them to have it because it's a small group? Trick question. It's D, all of the above, as we've gone through in the presentation here. When we look to then about, hey, let's talk SHOP, the Small Business Health Options Program, and how that interacts with Medicare. Well, SHOP coverage It's for small employers who want to provide health and or dental coverage to their employees. These plans are available through the company's direct or agents and brokers such as us, but not through healthcare.gov. And this is another scenario where they may be delaying their Part B enrollment because they have the SHOP coverage, and that's that coverage through the employer. It's treated the same as coverage through an employer group health plan. So we've got creditable coverage here, and so they're able to delay their Part B enrollment without penalty. Keep in mind, as this coverage ends, should it be voluntary or involuntarily, they have an SEP, a special enrollment period, to sign up for Part B without penalty, and it gives them then the opportunity to ascertain not only what coverages are available to them directly, but also what is available through spouse employment as well. And this is a longer period of choices that they have made available, because it's an 8-month period versus the 7-month period we'll see in some of the others. If an individual doesn't qualify or doesn't sign up during this special election period, they may have that late enrollment penalty for as long as they have Part B, which in most cases is lifetime. And they then have to go through Medicare's general enrollment period. That's the thing we showed just a little bit ago, the first quarter of the year. It then allows them to pick the coverage up July 1st. So you must enroll in Medicare Part B if you have SHOP coverage. Is that true or false? We've already talked about it. They can defer it, so it's false. We look at some of the programs, too, that can have an influence as to how they make that decision. Am I going to stay on Marketplace plan? Am I going to take advantage of the Medicare coverage that I now qualify for? And we have to be aware of the programs that can help them pay for Medicare. So this is where the discussion of the Medicare savings programs come into play. We have an entire presentation on this. This will be part of the link to our general library of past presentations. If you're active in this space, you need to be aware of it. And this gives them then the opportunity to have the state in which they reside, in conjunction with the federal government, help pay the Medicare costs. And this is for folks that are of limited income and resources. So you have the income and an assets test they have to deal with. And this is a program that is designed for, we talked about the working aged, bad term. This sometimes is referred to as the near poor. So these are the folks that are falling into the category of 100 to 135% of federal poverty level. And this then can be helpful for those folks that may have been receiving premium tax credits, excuse me, and or cost sharing reductions within the marketplace. Very pertinent to that situation. You have 4 different categories: qualified Medicare beneficiary, QMB, specified low-income Medicare beneficiary, SLMB, SLMB, or QMB as the other one, qualifying individual, and then the folks we don't run across nearly as often, the qualified disabled and working individuals. So different programs with different levels of support based on how they qualify for one level or another. As I referenced, that's another webinar. There's also the programs that enable them to get help with the drug costs, which is a big consideration, particularly if they're coming off marketplace plans, because some of the coverages may not have this type of assistance program available to them. And we all realize that the cost of medications is a huge factor in plan choices and in, hey, what are we going to do? Just plain and simple. This LIS, Low Income Subsidy Extra Help Program, is a program that is designed to help with Medicare prescription drug costs. And once again, it is for folks with limited income and resources. This goes up to 150% of federal poverty level to get at least some level of assistance. All of the folks that qualify for an MSP automatically get LIS. MOUSE, MICKY. No, I'm using acronyms again, but we're talking about Medicare savings plans and low income subsidy. This is a great help for those folks because there's no coverage gap, and that late enrollment penalty that some of them might be subject to, well, it's covered by LIS. And it is a continuous special election period, so they can qualify for this one time in each of or make a move with this one time in each quarter for the first 3 quarters. The last one, it's the general election period, the AEP, that enables them to change coverage. It used to be monthly, changed a couple years ago. If a person is looking for this assistance, as I mentioned, they automatically get it if they have full Medicaid or SSI, but also the Medicare savings programs is what I referenced. All others, well, they got to apply for it. They can do it online at the Social Security website. They can call Social Security to do it. They can contact the SHIP office. They can contact the Medicaid office. We have, however, services like this available with many of the carriers with whom you already contract or need to contract with that have an arrangement with different programs that can help this way. You see a lot of advertisement for carriers on there through programs through the National Council on Aging, where some carriers actually have services that help qualify members for this additional assistance. And that can vary from carrier to carrier. For the folks that think they might qualify, we need to review the income and resources guidelines. That's going to come to you as part of the follow-up as well. And then collect the basic information that is needed to complete these applications. Keep in mind, documentation isn't part of the scenario. The government's going to look into different accounts and find out through some of the internal resources if a person qualifies for it or not. And there are different pieces of websites and different things that you can access this information as well. It's going to come to you as part of the follow-up too. So when we check this circumstance on the knowledge check here, does a person qualify for extra help for Medicare prescription drug costs if they get help from Medicaid paying the Part B or that's basically the Medicare savings programs? True or false? Mentioned that just a few moments ago. It's true in this circumstance. If they're qualifying for MSP, LIS is going to come right along with it. One of the things that is made available to the population and how the government accesses a lot of this detail is through the Medicare periodic data matching system. And this is a process that identifies whether or not a person's enrolled in Part A or an MA plan or Marketplace, and they're looking to match the enrollment data. And they're then notified by Marketplace if they have Medicare and a Marketplace plan and are receiving those tax credits, that there are certain things they need to do. And this gives us the information that is put out to that population. We need to be aware of it, and we need to be able to help them with these basics. I know sometimes it's like, gee, it's riding a bike. Pretty simple when you know how. Most of us learn really early. But if you don't know how, you've never been on a bike, sometimes you need a little help. You need those training wheels. So we need to be able to deliver upon this and remind them that Marketplace will be able to end their premium tax credits and cost-sharing reductions if they're enrolled in Medicare and Marketplace. So this is going to prompt that population to seek out alternatives. And that's where we come into play. And it'll add an attestation to the application that these folks have to deal with. And they need to be aware of the fact that this has solid financial ramifications, to use that word again, that they need to be aware of. This also makes certain that they need to know the timelines that come into play and that they have 30 days to return to the Marketplace to either end those tax credits and cost-sharing reductions or cancel out of the plan. And that goes back to some of the previous slides as to, is that advantageous for them or not? A lot of it is predicated on that premium-free Part A coverage. That can make a big difference. And they'll have details on how to do that and the options to dispute some of the information that comes into play with it. So once again, laying out that detail as to what is premium free. Now keep in mind, this has got a date from last year. This is the most recent information pulled off this presentation. We need to make certain that they realize that, okay, that's a rolling number. End of June is when we need to make certain that we satisfy these requirements that are placed upon us. So if a person has a Marketplace plan, they're eligible for premium tax credits, cost sharing reductions, even if they have Medicare. Nope. They have Medicare, that ends. So we've got different helpful resources that we can access as well making certain that we're able to connect with the marketplace, look at the different resources available to the population through Medicare and other resources. Gee, what are some of those other resources? That's you and me. That's the information through the independent brokers or the brokers that are captive in a capacity, whatever. The information we're able to deliver on this topic, and we have that right here in this presentation. We also have access to the different social media accounts to connect with the marketplace. It keeps us up to date on developments, really pertinent in today's society with the extension of the SEP for enrollment in the marketplace itself. So we have different mandates that are coming out of the current administration that are changing some of the timelines. We need to be aware of them and how we can be that provider of information to folks that may have missed that, and some do. And that's the way it is. We just need to deal with it. There are also different training pieces that come into play. For those of you active in the under 65 space, you're probably well aware of this as is. There are a portion of us on the call that aren't as active in that market. We need some help, and that will do that. And we then have similar resources for the Medicare products that we've talked about as well. Great ways for you to go in there and access this information, be familiar with it, and make certain that we know how to get answers to the questions we may not know off the top of our head. You have the resources here. You have your contracting uplines that are active in the Medicare space that can help you as well. This is more information on links that come into play for different portions of the population we deal with. Because, yeah, the whole household may not be eligible for Medicare. One very important party within it will be, but we need to make certain that we cover some of the other aspects of that decision-making process that is so very important for us. Some of the key points to remember when we deal with this: Medicare is not part of the marketplace. Most of the time, it's best to have Medicare. If an individual already has Medicare, they can't probably enroll in Marketplace anyway. And if they have premium-free Part A and keep the Marketplace plan, does away with those subsidies. They have to pay full price for that Marketplace plan, so that's a real influencer as to what's their best choice. And they may need to make certain that they're doing their due diligence and ending those premium tax credits because of their Medicare coverage. It's also important to note that if they don't enroll when they can, there are ramifications, the penalties and the gaps in coverages that come into play. And in certain circumstances, if they want to maintain that marketplace coverage and they have other things that come into play, they might have to be responsible for paying some of that back. So timing is crucial, particularly when they're canceling their marketplace plan. It's important, whatever coverages we have. But in this instance, they really need to be made aware of the timetables that come into play. You have, as part of this presentation, an acronym guide that can be very helpful to you. Keep in mind that link to the full acronym guide. I'd send you the guide, but it'd kick you right out into a spam filter in many cases, or wouldn't go through it all because it's a very large guide. That's why we send the link. This gives you some of the acronyms that are very frequently referenced through this presentation. There's, as I mentioned before, additional training material available at that CMS website, the National Training Program. Let me give you a peek of this real quick. You have pieces like this that are invaluable. A third-party influencer that gives you the information in a synopsis type of scenario where IRMA comes into play, the programs that are for higher income individuals and the monies they may have to pay based on that. Don't run across that all that much when you've got a median income of a Medicare beneficiary right about 27 grand, slightly under. There are people that make more, obviously. This will come to you as a link as well. We want to make certain that you have the information as much as possible disseminated now, but also where you can get it if you're looking for something that we don't have right as part of the follow-up. So before we do the close of this, we want to make certain that we address any questions that may have come into play. We talked about some of this. Tina, you're asking about, do they have to enroll in Part A for SHOP? Depends upon the size of the group. Most of the time, yes, because those are generally smaller organizations under 20 where Medicare is primary. That comes into play. That was the only thing I think that we didn't cover. What was the resources for people who deal with higher income? IRMAA, IRMA, and that will come to you with those guidelines that we showed you very briefly. Sorry, I flashed by that pretty quickly, but it speaks to the different costs. And then as part of this, that's that guide based on income on filed tax returns is where it's coming to for an individual and a couple. And that, once again, is part of the follow-up that you will see after today's presentation. So we've talked about the circumstances that predicates a move from Marketplace or not, and then how do we deal with the programs that can help those folks that need to take the avenue of Medicare coverage for one reason or another. Well, some of the things that you'll see from us here at Premier is an electronic system in order to become involved in those programs. Many of you already have those contracts in place. For those of you that have them with us, thanks. For those of you who don't, good for you, but let's look at all the possibilities that may be pertinent for your market. This software system, available through our website, enables you to create an agent profile and then use that information to autofill automatically through an electronic process through a number of different carriers. For certain organizations that don't participate in this program, different carriers, not everybody does. Some of them may have electronic links to do it as well. We keep talking electronically because, in all honesty, some of us have handwriting that just stinks. Years ago, when I was a regional director for a major SNP program, that was before a lot of the electronic influence. Tells you how old I am, how long ago that was. But 80% of our applications pended because we had to translate the handwriting that came in on the application. That's why you see a big push for e-apps, one of the reasons, and why we see this as well. It doesn't allow us to miss a question, and it enables us to get away from the chickenese that many of us speak to in the written word. We also give you an opportunity to make certain that you're protecting yourself through errors in admission coverage, a discounted program for qualified agents. What makes you a qualified agent? You got a contract with us. But this is a program you own, and it covers you with that for that requirement that just about every carrier does now. You have to have E&O, most of the time at minimum of $1 million. This gives you a circumstance that will cover you regardless of whom you contract through. Obviously, we'd like you to be with us, but we realize we don't offer everything. Nobody does, no matter what they tell you. It is a circumstance then that you can use that to fulfill that requirement across the board, and you'll see it comes into play for even some of the variable stuff that's harder to get errors and admissions coverage for. We do offer also discounted continuing education to keep your license in play through our relationship with WebCE, and a way for you to add to your own benefit package as an independent insurance agent on a modified guarantee issued disability income program where you're paid a commission on a product you're selling yourself. Great way to add to your benefits, protect your earning ability. Much as where today's presentation is being recorded, we have a library of past presentations that go into other portions of the market that influences us. I'm very active, obviously, in the Medicare and Ancillary space, but my counterparts in other silos of the insurance world, life insurance, disability income, long-term care, all that, that is also part of the library of past presentations that are available for you 24/7 through our website at premiersmi.com, that link right there, or through our YouTube channel. As an agent contracted with us too, you automatically get or will get electronic tool access to Medicare Center. And this is a program designed to give you access to the quoting and presentation options available to you in the Medicare space, a singular login that gives you access to the different programs powered by Connecture, Sunfire, and CSG. It also delivers upon a program that allows you to collect the regulatory requirements to discuss these different products, scope of appointment, doing so electronically, storing it for that mandatory 10-year period if you sell them or not. So that's the requirement with the government. and we have that built into the system to do that for you and make certain that you stay compliant, and then roll in that customer database that can help you manage and track your clients, which is so important for us all. That CSG piece actually also gives you an opportunity to cross-sell, a great tool within it to help them fill in the gaps. A great way for you to use it across the board. Many of the carriers that have programs out there that give you extra incentives. In the Medicare space, doesn't apply to Medicare Advantage or PDP. The max comp for that is set by the government. Most of the carriers, that's what they roll out. They pay you as much as they can. It's all part of our contracting process as well. But if you're involved in the Medicare supplement space, ancillary programs, other factions of the insurance industry, many of those carriers will have trips and incentives. We want to make certain you have a singular point on our website to access all that information, and those in many cases will help you qualify for premier incentive programs as well. Last year it was to be a cruise, turned into a virtual getaway, cash in the pocket of the people that qualified. We also want to help you get in front of people. This gives you an opportunity to create a custom contact list through some of the sources we have available to you at a minimal cost or no cost at all for those in certain contracting situations. And then how you address the community through community-based marketing programs. We talked about that presentation that comes to you that speaks to Medicare and the Marketplace. That is an invaluable piece to use with centers of influence in the community. And that's the faith-based organizations, the senior centers, the different places that look for speakers that you can then present that presentation as a service to your partners in the community, those centers of influence. We also have programs that help you maximize the value out of retail marketing, the infamous Walmart program, or programs by the different carriers that roll out there. If you've been involved in that and you think, hey, it ends with AEP, you're selling yourself short. That's a year-round opportunity for you, as is accessing marketing opportunities to people that deliver the care for the programs that we're insuring. So doctors, specialists, hospitals, dentists, those sorts of individuals, DME, home health care organizations that we can partner with and make it a symbiotic relationship for all carriers, all involved. Different carriers do generate prospects for us as well. If you're engaged now in the Medicare Advantage space or PDP space, you realize that symbiotic relationship, that give and take, hey, you scratch my back, I scratch yours, throughout the year, that may enable you to get in front of people that are raising their hands in response to that carrier's marketing activity. And we want to make certain that we have you set up to take advantage of that as well, should you qualify. We do offer internet leads and direct mail program and a specific program for you to help you maximize that cost-effective, most effective lead generation program called referrals. So if you're looking for help with the direct mail, a tried and true way of giving you information for people to speak with two programs, one for the health products and one for final expense, you can qualify for both. Based on production, deeply discounts it so you can do it regularly, which is where you get the most benefit out of it. And we do so through vetted lead vendors in order to help protect you for compliance reasons as well. We also have programs that come into play that if you want a more immediate response off of direct mail, you don't want to spend the full amount for that, you have an opportunity to purchase leads that have come back on direct mail programs through some of the associations we have with different companies, a couple of them. Prices will vary according to area and according to time of year and that sort of thing, but it's a great way to augment your call list. How can I get in front of people? One way to do it. And you can do it through our Facebook program too, that give you an opportunity to get a little more immediate response through final expense or Medicare leads. Referrals, man, best way to get in front of people. You work your book of business. You ask people if you sell them or not. We have a recording on how to maximize that as a lead source too. We say all that, and I'm at the top of the hour. I apologize. I'm talking fast. You think those 4 cups of coffee would help? Well, we go through all this because we want your business as well. We want you to refer people to us as well as agents within our community. And do so with that sense of urgency. Make it part of your personal marketing plan. If you don't run across people or aren't active in the under 65 market, you don't have as much exposure to Marketplace, it behooves you to be aware of it, obviously. But we want to make certain we engage different components so you aren't putting all your eggs in one basket. And as John Wayne said in the movie The Cowboys, hey, we're burning daylight. Best way to do it, best time to do it, now. All that said, you're going to get the follow-up that is sent to you by email, so watch for that. It's got we'll have attachments and links, so some systems will pull that into your spam filter. Check for that. We generally send that out within a day or two of a presentation, or you can call us at 1-800-365-8208. You're working with a Premier Marketer now. They'll work through these programs with you. If you aren't with us yet, we'll assign you one of those as a resource to make certain that you get the information you need to be effective in this space. You can, of course, go to our website as well, complete what they call a JOT form. People will reach out to you for the items of interest, and we will help folks follow up for folks who raise their hand to make certain that we're answering questions. Speaking of questions, let's check and see what I may have not addressed. Okay, shop, higher income, the IRMA, problem encountered. How do you get past an HR office who has no clue on how to cancel near retiring employees? That is the infamous way of getting past the gatekeeper in certain circumstances, or an HR department that's directly addressing the question that is just ignorant on stuff. That is dependent upon you being able to make yourself a subject matter expert in their eyes. And we have a community presentation that may be able to help you in that area as well. You can personalize it. It's the great leave behind. A bunch of them will push it off to a committee, yada, yada, yada. Go through the infamous Seinfeld line. That's available to you. Can really help you. It's got hints and tips, too, on how to get past that initial resistance that you see in some of the areas that come into play. I think that pretty much covers it. So what I want to do is thank you for the investment of your time. It's your most valuable resource. We realize that. Thank you for the time you spent with us here today. For those of you that have worked with us in the past, we thank you for that association and for your business. For those of you that are about to enter into that relationship, we thank you for that opportunity as well. So watch for that email follow-up. Give us a buzz. You want it quicker? Watch for some of the follow-up that'll come to you. We'll make certain that we address any questions that may come in at the end of the presentation or whatever as part of the follow-up. But I thank you once again for the opportunity to speak with you. And until we're able to do so again, I wish you good selling. Thanks so very much, and we'll talk to you very, very soon.